So just a bit of, so just a little bit about my background. So I am a registered nurse in intellectual disability, and I worked for over 20 years in disability services in Ireland, and I have a special interest in older adults with intellectual disability. Um, I came in, and I'm interested in looking at transitions in later life. So I am a lecturer in the School of Nursing and Midwifery. So my case study for this presentation, the title of it is Planning for Transition and Shared Decision Making Among Older Adults with Intellectual Disabilities and Their Family Caregivers. Okay, so the overall aim was to explore and provide insights from both perspectives of planning for transition and decision making among a sample of older adults and their primary family caregiver. So within this sample, these individuals were identified from a waiting list. They are considering a permanent relocation and have initiated an application for residential care. Okay, so that's just the overall aim of it. So how I integrated PPI in the planning stage. Okay. So overall, my design was IPA, and I took a multi-perspective. And the underlying philosophy was that I was going to explore the phenomenon from both the perspective of the older adult and their family caregiver, which presented challenges. Just from my experiences of supporting people with intellectual disabilities, I was aware that there can be communication challenges. There can be difficulties with abstract thinking, especially concepts such as decision making and transitioning can be difficult for them to comprehend. And also, even understanding their understanding me and my understanding of their sense making. So they were some of the challenges that I kind of thought I might have before I started, based on my experience. And all this, so the literature identifies some of these challenges as well. So they would say that it is challenging, you need to be creative and flexible. And also that often interviews need a lot more scaffolding. And when we say scaffolding, is that they need a lot more supports from the interviewer, environmental communication supports. And often the conversation is more dyadic. The interview is more dyadic and conversational, and that would be the case in a lot of interviews. So there's a lot more input from the interviewer. So my PPI design. So I had worked with a group on a previous project, and I was familiar with the individuals. And during the summer 2022, I engaged with 4 individuals within this PPI group. They had between moderate and a mild level of intellectual disability, and also a clinical nurse specialist in communication. So it was very much participant or the PPI led. So I met them, I told them about my study, I invited them, were they interested, would they help me? And they were really, really enthusiastic. So we met 4 times, but there was a bit of work going on in the background as well, between the clinical nurse specialist who works with them, quite regularly, and they were working on different things. So what we did then, okay, so we co-created, the first thing we looked at was to be including the person with intellectual disability in a meaningful way. So we needed to look at the information we gave them. We have ethical considerations. So we needed to look at consent, informed consent that was meaningful and was appropriate for the participants. We also looked at the interview schedule. So we needed to look at a lot of multisensory approaches, just visual things that we needed to help them to, elicit memories, or maybe to make judgments on situations or experiences that they were exposed to. Would they be able to verbalize that, or would they be able to make choices relevant to their wishes, etc. So we had no problem creating the easy read versions of the consent and the participant information and the interview schedule. But one of the things that we found challenging, and we had to go away and think about it, was concepts such as shared decision making and transitioning were very difficult for them to understand. They didn't understand it. So what actually came from the PPI group, that they created a specific case vignette, which was like a storybook. And they created it with the view to, it told a story of somebody who was aging, mum was aging, they were living at home, and it spoke about the scenario, what happened to them and their experiences. And I have views, I'm at the end of collecting my data now, and it's been fantastic to help the person understand what I'm talking about. I think if I hadn't engaged with the PPI group, I don't think I would have got the level of data I was able to achieve, and even consent, that was very meaningful, and the person was really understanding what I was talking about. We also tested the resources that we made to see were they effective with the group as well. So they volunteered to see, did they understand it and was it appropriate for them? So I just have 2 slides here with just screenshots. So this is the accessible interview. So the clinical nurse specialist had the Boardmaker software. So it's a communication style, and it can help people to understand concepts that they find challenging. And for example, in the first picture here, we speak about aging, and what was interesting, the individuals from my own study, they understood aging, but not so much in themselves and not so much in their family caregiver, but they could recognize it in the media. So that was an interesting finding. And then we spoke about, things like what they do every day. Do they know anybody that moved? Respite was a really good hook for us to work on too, because a lot of the individuals had access to respite care, and they were able to draw from their experiences to inform my research study. So that was so we sat together and we worked through the interview schedule and undertook the interviews informed by that. Some individuals then, and actually very few, only one of my participants didn't really understand it. The rest of them were able to their level understand the interview questions, and it was great. I was delighted with it. So then the transitional vignette, which was the story. So these are once again just screen grabs from the book that we created. And once again, introduced to this individual. This is just a picture from the media that they chose, and people, they identified a lot of the participants said, oh, I know that person, so there was a familiarity around it. And then we talked about, aging, maybe, they might need increasing needs as they age, more support, getting on the bus, simple daily things. In the last screen grab, then we have like decision making, or feelings around making decisions. And, people were able to quite clearly tell me if they didn't want to transition. Some individuals, identified, others, my life is totally different. So it was very clear from their impressions from the vignette. So just some benefits from overall, just to wrap it up. So there was broader and there was more specific benefits from engaging with PPI. So I would recommend it. It wasn't difficult, and it actually helped. It wasn't something that I would just did for to tick a box, but it actually was really, really helpful for my study. So it informed my strategies and the strategies of the project to include older adults with intellectual disability. Qualitative strategies were strengthened as a result. So because I'm using IPA, there's, the individual or the idiographic is really, really important. So it allowed me to capture the person's experiences based on my interviews and based on their reactions even to the resources I used. So the strategies compensated for different capabilities and different experiences of individuals as well. So it helped them to read, process, understand, and express their wishes, their consent, and their experiences during the research study. On a wider level then, engagement with the PPI group was usually beneficial to me as an early career researcher. It helps me to develop my inclusive research strategies. It also, and I hope that it will advance learning in this area. I hope to publish from my learning and the benefits to inform other researchers who are researching in the area and to advocate for PPI involvement. It also facilitated, so in my gaps in the literature, there was a clear absence of the voice of the older person. So it allowed us to capture the voice of people with intellectual disability who often are in a commonplace experience of transitioning from the family home to long-term care in later life. And some of my participants spoke about aging in place. Even though they were on a waiting list, they were making provisions to age in place, which was absolutely fantastic as well. So it wasn't automatically that everybody was looking to transition. It was about looking at options and choices in later life and seeing what resources they need to put into place. It champions diversity and equality and inclusion of people with intellectual disability, creation of reasonable adjustments to support data collection and also the ethical considerations. And the study aligned then with CRPD capacity legislation here in Ireland and also the SDGs, because the study looked at, you know, inclusion of a vulnerable population, reducing inequality and reducing discrimination for this population. Thank you for listening to my presentation. I hope you found it helpful to you. Thanks. I'll stop sharing now.
Thank you, Caroline. That was great. So we will have a space for everyone to ask questions as well. So if you want to jot them down or you want to put in the chat, we will come back to Caroline and the other speakers as well. So now, Marion, can I jump over to you? Can you try to test to share your screen? If you need me, I'm here.
Great, thanks. That working?
Yes.
Brilliant. Okay. So I want to start by asking a question. So I'm Marion Clark, and I wanted to say, if patient involvement was part of my MSc, can we all find a place for it in our PhDs? So I'm in my second part-time year of a PhD in psychology at UCD. And though I'm still in the beginning stages of my PhD, it follows on from the impact of patient involvement on my master's research. So I know it can feel intimidating to find out about one more thing you need to incorporate into your PhD. So here's this guy with this.
Hello.
With this, sorry?
I think someone has their audio on.
So here's this guy with this big waterfall of overwhelmingness of all the things that we're supposed to read and find out about to incorporate into our PhD. But I want to ask you, if I was able to include patient involvement in my master's, is it possible to find a place for patient involvement to impact our PhDs? So my core message has 3 parts. One, if you feel you don't have enough time to do PPI in a PhD, could you just keep it simple? Find one area or even one concept where patient involvement could have most impact on your research. The second question, if you feel it's too late, well, isn't it better late than never? And finally, if you think, I'll just wait and do it next time, why wait? Because incorporating patient involvement into one project by its very nature can create opportunities for the next piece of patient involvement research. So a few years ago, as part of my MSc in Loss and Bereavement Counseling at RCSI, I built an action research project based in a local hospital pain management program, or PMP, alongside the senior clinical psychologist. We used creative practice and focus group formats to explore whether dealing with the losses associated with chronic pain resembled a grief experience. PPI involvement was a key element of our plan, and literally the day that we put in our ethics application, the day after was the day that COVID started. So COVID interrupted and really radically altered my whole project, but one tiny and informal piece of patient involvement was still transformative for my MSc. Sorry, is that progressing?
Yep, there you go.
Okay.
There you go.
So if you feel I don't have time, could you just keep it simple? 2 words from the grief literature were foundational to my project: post-traumatic growth, or PTG, and resilience. So post-traumatic growth, as per Tedeschi and Calhoun, refers to positive psychological change experienced as a result of the struggle with highly challenging life circumstances. Another kind of split off from that, or not split off from that, another concept is resilience. According to Bonanno, reflects the ability to maintain a stable equilibrium, enduring the temporary upheaval of loss or traumatic events, and moving on with apparent ease or without doing much therapeutic work. So these describe some possible reactions to a major loss. So they're a part of this large spectrum of potential grief trajectories that I hypothesized might be relevant in considering the loss experiences of living with chronic pain. But as I considered my project further, the words felt very problematic. Post-traumatic growth, resilience, they are the right words for the phenomena in the academic context. They've been used over and over in research and publications. Their meanings are sharpened and built. But as a patient, words that are part of the academic lingo can really perpetuate stigma and disenfranchisement because they carry the force and weight of everyone who's spoken them before. Some words might feel like a threat to withhold further treatment, or as a critique of what hasn't been done or learned, perhaps even as a way to place blame on a patient's shoulders rather than admit a medical defeat, or to minimize or even cast doubt on the legitimacy of a patient's pain altogether. I felt this on a really deep level, both because I entered my master's program with many years of counseling experience, but also because I am a chronic pain patient. Now, with that in mind, it would be easy to think that as a patient myself, I don't need PPI. But in many ways, I feel the need for patient input even more, because I could easily begin to think that my patient experience, my understanding or perspective is representative of all chronic pain patients. So before this dilemma started, very shortly in my MSc, I had started a conversation with fellow pain patients about how we experienced and dealt with loss. It was a peer conversation over lunches together during our own pain management program. I had no thought at that time of doing my research in pain, but eventually over a year, those conversations grew into the idea for my research. Every once in a while, I would ask a new question or bring a new thought into the group and we would discuss it. So going back into my master's from these conversations over lunch, as I tried to write my patient information leaflet on paper, not only is post-traumatic growth a mouthful, it read like this saccharine, pink packaged, shiny, false hope of growth, suggesting growth feels dismissive of the gravity of trauma, which for the chronic pain population can be an ongoing experience. Resilience, as I read further on what I'd written of my PIL, sounded like a backhanded compliment to those in chronic pain, praise for correct non-pain behavior, but with an undercurrent of stigma, the assumption that maybe their pain isn't really that bad after all. It was at this point, coming from two places, conversations with my pain peers, and then trying to develop a project to write about, that as I started to develop the project formally, I asked the patients from my own hospital-based pain management program. And this is a group which had been externally determined. It's relatively representative of the chronic pain population in Ireland. If any of them would be willing to brainstorm with me around writing the study's patient information leaflet. Of 8 fellow patients in that group, 4 of them volunteered. And because we couldn't meet in person, we created a WhatsApp group. Through a few texts back and forth between the 5 of us over a couple of weeks, we crafted a word, one simple word that became pivotal for my MSc project. We discussed post-traumatic growth and resilience and the concepts they represent in the experience of living with pain and what each of us heard or felt when they were spoken to us or about us. We decided in the end to combine these concepts under the more patient experience affirming word strength as part of the title and description in my patient information leaflet. The group was encouraging and helpful throughout my project. But that snapshot is the clearest impact of patient involvement in my MSc research. In the end, strength became a central concept for my project as a whole, and one of those precious 15 words of my dissertation title. So, is there a way that you can take one simple step towards involving patients? Choose one element of your project that feels a bit like this, a puzzle that you can't figure out. Maybe even just one topic or term where you've noticed a disconnect or glazed faces or furrowed brows on your family and friends as you discuss your research, and then start a conversation. Start with them, because that's the start of PPI. Staley and Barron suggest PPI is a thread of conversation that supports two-way learning between peers. Ideally, this is going to be most transformative when it runs through research from the start to finish, just as that simple group functioned for me. But that timing isn't possible for everyone, especially on a PhD timeline. So What if you feel it's too late? Isn't it better to start? Isn't it better late than never? So I had a head start and a pre-existing group of patients with inbuilt trust, not to mention COVID gave us enough time to chatter away. But if you're at the early part of your PhD, there's time to read about PPI, talk with your supervisor, and with PPI Ignite, join our shared learning group. It's great, and we're happy for people to sit and just listen for a while. There's no obligation to know anything about PPI or have any plans to use it yet. But what if you're in your final year? Your studies are finished and you're already writing it all up. Then start there. It might not tick all the boxes to be some fully fledged, perfect PPI project. I knew that mine didn't fully tick every PPI box, but everyone has to start somewhere. A simple consultation with a patient organization, even at publication stage, could make a difference to how you report on your research, which on its own makes a difference. Many who work at patient organizations are patients or carers for patients themselves and could reflect with you on terminology, keeping in mind not just what our words mean in an academic sense, but also what they mean to the people they're most significant to and whose experience they're describing. An example before about post-traumatic growth and resilience. In writing my dissertation and in presenting my work, certainly I retained the academic terminology in order to appropriately reference and clearly communicate very specific concepts to an academic audience. But by continuing to bracket them under that patient-chosen word strength, they had less power to diminish or dismiss patient experience. So what if you think, I'll just wait and do it next time? Why wait? Consider this: incorporating PPI into your current project, by its very nature, creates opportunities for your next piece of research. Patient and public engagement in research has a core value of engaging patients in the public and reading research. We can make our reporting even more accessible, even more engaging for a broader audience by using, including patients, by using visual imagery well, according to Rower et al. Knowing that, trace this progression. The year after my MSc, 1, I was able to share my research with some fellow patients through an interactive art project. 2, during that, a pain peer created an illustration for the grief concept oscillation. 3, that's what you see there on the left. I incorporated that into the poster for my next academic conference. 4, through it, I've had significant engagements, not only with other academics, 5, and practitioners, 6, I don't have enough fingers anymore, but also with patient representatives, 7. As a result of those contexts, I now have further opportunities, 8, which I hope will more easily and thoroughly integrate PPI into my PhD, 9. 9 opportunities, and I'm only technically halfway into year 1 of my PhD. I've lost my last page. So patient involvement in my COVID era MSc means we can all find a place for it in our PhDs. Keep it simple. It's better late than never. And why wait? And please consider joining our shared learning group.
Thanks, Marion. That was great. Really insightful and, great questions that you're asking and putting out there for us to reflect. So everyone, like I said, we'll have some room for questions at the end. I know someone asked how they can join the network. We're also going to be talking about that as well. But Emmy has kindly put a link on the chat if anyone already wants to kind of do that. So I would invite Jennifer now to give her talk. Thanks, Jennifer. You want to try to share and let's see how it goes?
There are 2 hard acts to follow, so perfect. Is that sharing? Brilliant.
Perfect.
So hi everyone. So my name is Jennifer. I'm a final year PhD student based out of School of Public Health. I'm also registered with the Sphere program, and I'm also part of a collaborative doctoral program, which is composed or made up of 8 PhD students, all looking at trying to improve diabetes-related lower extremity outcomes, so preventing ulcerations and amputations. I'm a podiatrist by background, and prior to starting the PhD, I worked clinically. So I would have always thought I was very comfortable at, speaking and working with the general public and people with lived experience. But I'll talk a little bit about that. And then just to give a bit of context to my PhD itself, it's looking at, so people with diabetes, they're at increased risk of developing ulcers and amputations, but there are specific risk factors that we can screen for to prevent ulcerations and amputations. So my PhD is looking at how do we improve screening, patient access to screening, and identification of the at-risk foot. So with the people I work with and people with lived experience, it's people with diagnosis of diabetes and also their families and carers. So I'm just going to talk, I suppose, kind of reflections on and a little bit of lessons learned throughout my PPI and my PhD journey. I'd have to say, I think when I first started PhD and I started learning about incorporating PPI into my research, I was very much the guy here on the left. I was thinking to myself, how am I going to navigate it all? How am I going to set up a panel? Why would someone want to join my panel, give up their free time? How do I go about facilitating meetings? And when I started my PhD, we were very much in the height of COVID. So I knew my PPI group that we would not be meeting in person. I knew it would be online. And that was something I was terrified about. I was not used to facilitating groups online and also bringing different people together from different backgrounds. And it was just, I was very overwhelmed. But the light at the end of the tunnel, I'm through it, and I was very much wrong with my initial, I suppose, fear. So I'm just going to talk a little bit about setting up and working with the group. So I'm just going to move that out of the way. So I came into my PhD with a predefined topic. So some people, when they come into it, they don't know what their research questions are. They don't know what they're going to be looking at specifically. I felt I knew quite well what the overall PhD aims and objectives would be, what the specific studies were going to be. And I kind of struggled initially with wondering, well, how do I incorporate PPI into my research? I think I was all quite, I suppose, overwhelmed by it all. In my case, I wasn't asking people to join this group to give their insights in what they would like done. I was coming to them with specific topics, specific studies. I kind of felt, I suppose I kind of struggled with what I was going to ask them. This is where the PPI shared learning group came into play, and where discussions with the program managers really helped me, from having discussions throughout the learning group, I suppose, what others are doing. And we'd heard kind of in the previous talks that you don't have to do it all. It doesn't have to be throughout each and every step and stage of your PhD. It can just be one key area. So for me, it was kind of that initial learning where I suppose the group really helped kind of, I suppose, to come up with a plan and initial ideas, so that when I was recruiting for my group, I could say, well, this is kind of work I hope you'll be involved with, hoping that you'll be help advise on X, Y, Z. This is the level of time I hope that you'll be able to provide throughout the next couple of years. So that was kind of, I suppose, initially knowing, what support I needed from the PPI group. Another, I suppose, piece of advice I got from the group as well, and from meeting with others, is trying to find someone who may be doing similar work to you, or trying to recruit similar groups of people to you. Now, I was lucky enough there was someone here in the School of Public Health that was working with people with diabetes. But I think that's one benefit as well of the shared learning group as well, is that it gives you the opportunity to connect in with people that you probably or maybe might not normally would. So people from different research centres or institutions. And I think as well, the way, I suppose, post-COVID, a lot of these meetings take place online. So you don't need to be working with someone within the same research group as you or the same institution, that a lot of the group meetings might take place online. So that's one thing as well, is just trying to, I suppose, find someone to work with, as well as helping in terms of the time. You know, you're trying to navigate all these things, having someone to share the developing and setting up a group, recruitment strategies, and to bounce ideas off of is really nice. Also, just the cost aspect as well. For me and Claire's, who I have my group with, you know, we're able to share the costs associated with reimbursing our PPI members as well. So that's an additional benefit. And also, it is a little bit nerve-wracking setting up and bringing a group of people together. You're kind of worried about IT issues if you're doing it online, or just general logistics if you're setting up a room. So if you can find someone to maybe set up a group with, you have someone to share those nerves with. Maybe as well, another thing, if you're having a discussion with your group, you don't want to be taking down notes. Having someone else there kind of in the room or online to jot down notes with or for you has been really beneficial as well. And then I suppose just terms of recruitment. And this is where I suppose having the discussions with others in the PPI group or with other networks is to bounce ideas off of. So either sharing your recruitment flyers and getting advice for, you know, we use flyers to recruit our PPI panels through social media and different groups, but having someone who has recruited previously and has developed a panel to be able to discuss with them what works or what doesn't work, also kind of really just helps the process, and also kind of what helps in terms of running your group as well. This is just a snapshot of benefits. It doesn't cover them all, but they're the ones that kind of just stand out for me. First one is the moral support you get from your PPI group. You know, PhD can be lonely sometimes. Sometimes you can be really busy and then it can just be really quiet for quite a while. And sometimes I feel quite bad sometimes that, you know, maybe I'm not connecting in with the PPI group maybe as much as I should. So every so often, you know, I send an update email saying, this is what I've been doing, this is what I'm working on. I hope to schedule the next meeting in the next month or two once, say, ethics comes through or something like that. And every time, without fail, you'll get a lovely email back from them as well, saying you're doing great, you're great work. Or else with the conversations with them, they kind of remind you why your work is important as well. It's kind of hard to forget that a little bit when you're getting, you know, peer-reviewed comments from journals or, you know, rejections after submitting an article you've been working on. That's not the most important part, I don't think, of it. It's when you actually see the impact your work is having on those who live with the condition or live with the disease. It's just that nice little reminder, even if you're only helping one or two people, as Paula said earlier in the presentation, that's kind of the best part, I find, for me anyway, of PPI and working with PPI. And then I suppose just practicality side of things as well is the impact it has on your research. You know, I was a little bit, I suppose, concerned when I first started with PPI. I was like, well, where do I bring it into my research? There's so many different elements. Like for one of my studies, my scope and review, I didn't see where PPI would fit in. But it was actually, I suppose, one conversation was around terminology. So I'm looking at screening and examining the foot and diabetes. And we kind of had a discussion with our PPI members of what these terms mean to them, which actually completely reframed one of my studies and the terminology used. And I'll talk a little bit again about the positive impacts, or also even just with my interviews. So I'm interviewing people with diabetes and healthcare professionals. And my PPI group, when we discussed it, came up with questions that I hadn't even thought of asking throughout, say, my actual qualitative interviews with participants. And it's now that I'm in kind of, I suppose, the thick of it and in the middle of doing interviews, just questions I'm asking and really kind of rich, valuable data that I'm collecting that I wouldn't have if I hadn't had those conversations with the PPI group. And as well, they help with recruitment for participants. So developing the recruitment flyers to invite people to take part in my study, or also, I suppose, groups to target, even just by linking in with people as well, that they know has been fantastic as well. And then I suppose other positive impacts as well. They help with wider dissemination. So one thing is helping with summaries of your research. So for example, scope review, it's quite technical, the write-up of it, but it's discussing with the PPI group, how can I make the findings generated more accessible to the wider public? And what do they mean to you? And also writing other bits like policy briefs to get out to the wider public. And then I suppose maybe one benefit I saw on a more international level. So I spoke kind of about, we'd been having a discussion about terminology and, what screening means to them and what examination means to them. And I actually, based on those conversations, I reached out to, so in diabetic foot disease, we have an international group and they make guidelines internationally for diabetic foot management, and they set out the definitions for diabetic foot care internationally. So I actually wrote to this group saying, I've been having this conversation with my group, my PPI group. What's your thought on this? What's your, I knew there was new guidelines coming out in the next year or next 12 months. So I said, what's happening with this? As a result, the lead of that got back in touch and said, that's a very good point. We've never actually really considered what screening examination means to people with lived experience. We wrote then a commentary from that, and in the most recent publication, Diabetic Foot Screening and Examination. So I wrote the commentary piece with the PPI group with their input, and we came up with their preferred definitions for screening, assessment, examination. And those definitions are now the actual internationally agreed terms for PPR, diabetic foot screening. So that was just a wider impact that I didn't even consider. I don't think would have actually ever been possible without the conversations with the members of my group. So that's just a very kind of brief, I suppose, reflection, lessons learned. If anyone ever wants to kind of reach out or discuss if any queries, more than happy to connect or discuss or anything like that. So I'm going to stop sharing, and that's me. So I'll hand over to, I think Emmy's going to take over.
Yeah.
Next second.
I'm just going to share the slide. Where is it? Just one sec.
Super. Thanks so much to our three speakers. Really, really appreciate your insights. It's lovely to hear the practical aspects of PPI and PhD research, but also the kind of more personal motivations and experience as well. Thanks for sharing those experiences, those honest experiences. I think that's what everyone needs to hear. And there's a great reaction in the chat, and I've gotten a couple of private messages as well with people who are really inspired and want to start doing PPI. So that's what this session is all about, is to inspire people to do PPI and join our shared learning group. So I set up the group a couple of years ago now, probably nearly 2 years ago now, really because I was looking at a lot of PhD students who were being encouraged by their supervisors to do PPI, but there was no support out there on how they would go about it. So I set up the first initial meeting, and I think we were overwhelmed. I can't remember now exactly how many people turned up, but there was great. And I knew from then, okay, this is going to kind of take on a life of its own, and it has. So the PPI Shared Learning Group for PhD students is a group really kind of, I just kind of set up the meetings, and it's really kind of everyone is involved in the facilitation. It meets once a month online, so we meet on Zoom, and it's really an informal opportunity for PhD students to keep up to date with latest PPI research and best practice and kind of approaches, but also for them to discuss their own PPI plans and experiences as well. And it's really, I know Paula mentioned earlier about, it being a safe space, and it is really like no one is put under pressure to share their PPI plans or experiences. There's plenty of people in the group who have no experience of PPI. So it's really only if you want to share, and if you want to kind of run things by people and get people's perspectives. And it's open to PhD researchers of all stages, from all organizations. So it's not just for those in UCC, it's not just for those in the universities associated with the network. It's really for anyone that wants to join. And like Paula mentioned, we've got quite a few people joining now from abroad as well, which is really exciting to see what people are doing in different countries. So I put a link into the chat if you want to join up to the mailing list. post. I'll put another link in there now in a minute just for ease of access. But please feel free to join up and come along to our next session. So it's usually the last Friday of every month. That's generally the date we go with for an hour. And I know we do have a couple of people in the room here that are members. We've got quite a few members of the group. So if anyone wants to talk about their experience of the group or highlight anything to participants, that would be great.
Hi, Emmy. I'm happy to jump in there.
Brilliant. Thank you.
Hi, I'm Ayla. I'm from University of Galway. I just wanted to, I suppose the group has been really helpful for me, and I just wanted to emphasize that, I think when I started my journey with the group, I wasn't really necessarily saying much in the meetings or contributing much in the meetings. But as I grew more confident and I started to learn more about PPI and start doing my own PPI in my own project, that's when I started to contribute, and that's when I started to have questions and ask. But as you mentioned, it's a really safe space, and it's also a really nice place to meet like-minded people who are going through a similar experience, and get a little bit nerdy about PPI too. Talk about the challenges and the benefits and the even sometimes theory of PPI and that kind of thing. But it's been a really fantastic experience that I will continue to use throughout my PhD journey.
Thanks, Ayla. Thanks for sharing. That's brilliant. Will we leave
Hi,
it
Emmy.
there? Is there any...
I can come in. Hi, everybody. My name is Avril McTague. I'm a PhD student in Trinity. I'm completely new to PPI, so I'm a relatively new member to the shared learning group. But I just wanted to say it's been a great opportunity to join and learn from others. So as you've heard from Paula, Marion, Caroline, and Jennifer, the wide variety of research that's going on and how PPI has been used. So I found the group really useful just to learn. I'm very new to PPI, so the group's been really supportive for me to learn and know, kind of to be signposted to resources, and then also then to link in with other researchers that I wouldn't necessarily have met outside of Trinity, which has been amazing. So if anyone would like to join, it would be great to have you and to continue our discussions on PPI. And thanks again for everyone for coming to the webinar today.
Super. Thanks, Avril. Anyone else want to say anything?
Hi, Emmy. I might jump in as well. My name is Darren. I'm in year 2 of my PhD in UCC. I suppose the group was most useful to me because I suppose when it came to the talks and things initially, it kind of motivated me towards incorporating PPI. And because my supervisors didn't really have any experience of PPI, they just wanted it incorporated somehow, but that was I suppose the level of their knowledge on the subject. So it was great to come somewhere where I could just ask people, okay, what's the next step? Where do I go? So the group really helped me with kind of a plan and organizing myself about how I would practically go about it as a person new to the area. So yeah, that's all I wanted to say. So thanks very much, Emma.
Thanks, Darren. Yeah, so the group is really kind of taken on a life of its own, and we have guest speakers, and we some sessions we focus on particular academic papers or PPI guidelines, and so it's great to see such involvement, and it's very motivational, I think, for everyone in the group, me included. So I will pass back to Paula, because I know Paula wants to tell us about some more events that are coming up that might be relevant.
Yeah, thanks, Emmy. Thanks everyone for sharing your experience of the shared learning group. I might just very briefly talk about mine as well. I know that when we talk about PPI, we talk a lot about the patient, and I don't have a healthcare background at all. I come from a business school, from marketing, and the shared learning group has been really helpful for me, especially because I can't talk about PPI amongst my department or my school. When I talk about it, people are like, what are you talking about? Like, what does this have to do with management or marketing? And for me to have this space with others that are kind of doing similar research to me has been really helpful. I've actually met people outside the group, you know, we've had online chats, we've shared emails, we've shared resources with each other. I've had people share with me their recruitment strategies so I can build mine. You know, and it's just great to make friends during the PhD as well. So that's just my experience. I thought that I'd share that with people. So just a little bit about what we still have coming up, and then we'll have room for a few questions if people would like to ask, is that, you know, I talked about the Ignite Insight series that we're doing. So other than just the webinars that's going to be happening, so this is the second one, we have another one that's going to talk about a gateway to interesting careers, which is really important to us as PhDs, because you know, just looking at our perspective and our own interests as well, you know, when we conduct PPI, what kind of jobs can we get after the PhD, right? Once we graduate and we survive it, what's going to be out there for us? So that's going to be talking about that. And we have some really interesting in-person events that you can attend as well. So we have events in UCC. We had an event in UCD. You know, there's going to be another one in TCD, also RSCI, and also another one in Galway. And you know, just the festival happening throughout. There's a bunch of events, and it's just really important that these events are really focused on us as PhDs, or independently where you are in your research journey, if you're just starting it, if you haven't started it at all and are just thinking about it, so we can learn and network with each other. We really want to build a base and support each other with this, and that's what we do with the shared learning group as well. And, you know, we're supported by the national office. So thank you very much for everyone that's been helping us, and everyone from the shared learning group that came together to organize this. I'm really excited that we have all these participants, and I'm really anxious, you know, to get into our questions. And just one last thing, we did talk about sharing these slides with everyone that's been attending. Also the link, and, you know, that you can sign up for the shared learning group as well. So here's just some useful resources. You will be able to get these after, but it talks about the experiences and reflections of doing PPI in doctoral PhD research. It might be useful for a lot of people, so it's really important, you know, that we go through these, and we'll be sharing them with you. So I will just stop. That was my last slide. I will stop sharing my screen. And I know Marion was going to take over for the Q&A, and I will just stop talking.
Thanks, Paula. So just as we enter into the time for questions, I'm going to ask you if you have questions. We have several in the chat that we're going to address. If you have a question, if you type it in there, or if you raise your hand, I will try to see it, but there are a lot of people here. So let's try and keep them typed into the message if possible. Also, we're going to stop or else delete the recording of this segment of questions.